Welcome back to Studio Chatter. Our friends from Utah Surgical Arts are with us to talk about oral health. Let's welcome Dr. Skip Holliday and Kyle Schiffler to the table.
Hello.
Thank you for being here.
Thanks for having us. Yeah.
I was just saying before, my work teams collide today, so
That's right.
I couldn't be more happy to have you guys.
Thanks.
These are our two newest on board at Utah Surgical Arts. We have 6 doctors total now, which is super awesome.
How many locations do you guys have?
We have kind of 4. I mean, pretty much 4. We just are frontiering Payson again, back at Dr. Trapnell's in Payson.
Oh, okay.
But we have South Jordan, we have Provo, Lehigh, and now back down to Payson.
Okay,
So do you work at a certain location or you move around?
There, between the 6 of us, there is a doctor at each location 5 days out of the week. I travel between the 3 kind of northern offices, and then he takes the middle down to the bottom. But we're the only ones that kind of go to lots and lots of different locations. But the other doctors will split time between at least a couple of offices.
So tell them a little bit about each of you and how you went into this field, and then what brought you here to USA.
Yeah, so the abbreviated form is I was born and raised in Arizona, went to dental school in Arizona and residency out in Memphis, Tennessee. And while I was a dental student in Arizona, I met Dr. Eric Wood, one of our other partners that's there, while he was a resident in Arizona. And so when I was looking for a job, my family had since then transplanted themselves from Arizona up to Utah, and so we considered looking into Utah. And just going through websites, I saw Dr. Eric Wood's name on our website, and I had his cell phone number, so I just called him out of the blue and was like,
you gave him a fist bump.
Yes,
like, hey,
I did.
Could I come
and I said,
visit?
hey, yeah, you remember me? And he was like, you can't be almost done. I'm like, I'm almost done. And he's like, oh, this is perfect timing. And that was pretty much the end of it. We started talking, and it was clearly the best fit for me was being with this practice, and so that was kind of all she wrote. And then we signed with him, and I came straight from Memphis straight to here and started.
So when did you start here?
We just started back in like June, July time.
Both of you?
Yeah.
Okay.
Yeah. I'm from Portland, Oregon. Grew up there, went to BYU, and then went to Los Angeles for dental school at UCLA, went to USC for medical school, and did the rest of my training. So I was in Los Angeles for, as I say, 10 years too long. So I need to get out of there and come to a more family-oriented, slower-paced place.
Totally.
So yeah, we moved here in June. I have 2 kids. You have 4
I should have mentioned
kids,
I have
right?
4 kids, yeah.
Okay.
And a loving wife.
Yes, very much.
Loving wife.
He knows my
Darling wives.
Yeah,
They're so
best.
dear.
Our better half.
Yes, exactly.
So Utah Surgical Arts, tell us exactly what you do.
So at Utah Surgical Arts, we're oral and maxillofacial surgeons, which means that we can be both in a hospital and doing things such as facial trauma and reconstructive jaw surgery and things like that. But the majority of us in here, we have our private practice where we do a lot more of the dental side of it. So we do wisdom teeth, dental implants, dental extractions, bone grafting, sinus lifts, all under sedation if necessary, that we can do in office. But primarily we do a lot of wisdom teeth and dental implants for people.
Okay.
So if I knock my teeth out and I need some new teeth,
We would be the guys.
how long does it take to, how long do I have to smile with no teeth?
Yeah.
Process.
Hopefully you don't have to smile without any teeth ever. You can do some type of prosthesis in between that time while you're recovering for
Some
things.
little retainers
Yeah,
with a little
exactly.
fake teeth on there.
Make them look
Take out
real
for
nice.
Halloween.
Exactly.
Be a pirate.
Yes, yeah. But for the most part, it can take anywhere from like 3 to 6 months or so, depending on the necessity of grafting or otherwise for bone and things like that. It just kind of depends. But it does take a couple months for it to heal appropriately.
I'm guessing, because this is how I would feel personally, you wouldn't be my favorite people to go see. You both look very nice.
No, we know our place in society, that's for sure.
Yeah, it just
Not many people want
when
to
your
see us.
mouth hurts,
Yeah.
you can't think of anything else.
Yeah.
That's why we put patients to sleep.
You won't remember
You don't
me.
remember us. Yeah,
In
exactly.
pain, wake up, and much better.
Honestly, I think because we go through such rigorous training, we're very specialized in what we do, and so it makes it kind of a unique field where we feel like we're the best equipped to treat certain things, and so most people heal fairly well. I think kind of gone are the days of being extremely swollen and hurting for weeks and weeks after wisdom teeth or something like that.
Okay.
Now it seems a little bit more streamlined streamlined, at least for us, and it's very few and far between that patients end up being like that, being super swollen and really, in a lot of pain. Most of the time, people do really well, honestly. And so, yeah, it's not fun to see us, but we try to make it a really just incredible experience from start to finish as you're meeting Angie at the front desk.
I was just going to say,
what more could you want?
You're beamed in as soon as you see her.
Yes, right. And then from start to finish with our staff and everyone who just takes such good care of all of our patients, they really do have such a unique experience that it's wonderful, actually.
Tell us a little bit about the accreditation and what that means to our practice.
Yeah, so our Provo office is accredited by a certain organization. It's AAAHC accredited, and basically it's a designated operating room. So it has the same standards of any hospital, and so we do big surgeries there, trauma, reconstruction, or if someone's medically compromised, we put them under general anesthesia with an anesthesiologist, and it has the same safety standards, the same protocols. So it's kind of a unique thing. I think it's still the only oral surgery practice in Utah that has that accreditation.
Yeah, it takes a lot
It's intense.
Yeah.
We have to write reports, and we have to still publish papers and things like that, trying to maintain this, where we could still do the same thing that we could do, in any office, but we feel that holds us to even a higher standard. So.
Right.
Yeah. I'd say our biggest thing is that we try to provide a Nordstrom experience to our patients. It's the doctors, they see us for a couple minutes. It's more the staff training, the high quality staff that we have, that patients come and they have a good experience. They feel like their time is taken to explain what we're doing and how the recovery goes and all that stuff. So we try to think about the big picture. It's not just about doing the procedure and treating patients. It's all about seeing the humanity in the people and trying to see things in their perspective, because it's a new experience for them. Yeah,
we won't leave you on just hanging out on a limb. You'll get our cell phones or something if you need to afterwards. It's we're really there from start to finish, and want you to know that we love and care for you, even if it is for that brief amount of time.
Yeah.
Well, okay, so we have wisdom teeth and implants that we've kind of touched on. Our typical wisdom teeth schedule, tell us a little bit about what that looks like if someone came in to get their wisdom teeth out. How fast is that? People are always kind of amazed with our process.
It is pretty mind-blowing. So we typically do a lot of consult extractions, so you don't have to come in just to do the consult. You can come and see us for the very first time. We'll talk to you, and we give specialized instruction with our front staff, and so they can kind of screen patients as necessary and set aside time appropriate. But we would see you, take the appropriate x-rays and any imaging that we would need, run over your health history and get you set up, and then we'd take you back into one of the surgical suites, and from start to finish it can take us probably less than 20 minutes or so to take out put you to sleep, take out your 4 wisdom teeth, wake you up, and then send you to the recovery afterwards. So it is pretty quick and streamlined. Like I said, we go to a lot of training to do it, and it might seem simple like taking out wisdom teeth, but they can be tricky and they can be hard. And
it sounds like it's very ridiculous. And are we usually going because the doctor has recommended us to go?
Correct, yeah. Most of the time they're referred by a general dentist or an orthodontist. Sometimes they just hear about it and know that they have wisdom teeth and at some point should get them taken out. But a lot of the decision is made by us and recommendations and things.
Yeah, a lot of people will call and say, do I need a referral? No, they do not.
Correct.
But it's nice if they've been, and then we know, hey, we're right about that age range, which is about 15-ish. We say to about 25 that you could just come in and do that same consult.
When in doubt, always come in and we'll talk to you about it and get you set up, whether it's
and
to do
just
it or later on.
educate you with everything.
Okay, and you guys were going to offer a discount on your copayment, right?
Yes.
Correct.
Do you guys remember what we're doing?
Yeah, 20%. For anyone who is watching it, correct?
Yes,
Angie will know more because we don't even really deal with the insurance side of it. They're the ones that do the whole thing. Yeah, all of our front desk.
They're the specialties. They're the hands. But if you call and book an appointment and just mention Studio Chatter, then you're going to get 20% off of your copay amount, so whatever that might be. If you're cash pay, we'll still do that 20% off. So these guys are amazing. It really is such a great place to work, and I'm just super proud of you guys for jumping in there and taking the reins on it.
Enjoy your careers.
Thank you.
That sounds awesome.
Yes.
Congratulations.
Thank you.
Thanks for coming.
What can you do with that box of old family photos? Stay with us to find out.